We haven't checked in a while and was wondering, as I have heard, there has been an increase in overdoses recently that EMS has had to respond to here in Madison County. Do you care to elaborate on this?
There has certainly been an increase, specifically since the onset of the COVID-19. As we talked about earlier, we saw a marked increase from in the 30-day interval between April 15th and May 15th, where we saw a 125% increase in Narcan usage by EMS as compared to the same time period of 2019.
Now, is this because Narcan is more readily available by private citizens instead of just being supplied by EMS?
That number is just the Narcan that was administered by EMS. So we are starting to see more Narcan usage in the public setting prior to our arrival. We've seen more of that lately than we've seen in prior months.
What other kinds of calls have you noticed looking at the data that EMS has responded to?
Well, just to follow up on our overdoses and looking at 2019 and 2020 for the first 6 months, obviously January through June, we're 38% up compared to the same time frame last year. But a lot of the other associated kind of spin-off problems of the opioid epidemic or the drug epidemic, since we're seeing meth a lot again as well, domestic violence, assaults, psychiatric emergencies and things like that. Seems to be a lot of depression, and some of that's probably COVID-19 related, where a lot of people are more isolated than they've ever been. So people with the addiction problem, that certainly impacts that more severely.
I mean, you mentioned the isolation, but what do you think is the main reason that this is tied to the COVID epidemic? Because I would think people are not working, maybe they wouldn't have money to get more drugs and then overdose, but I guess that's not the case from what you're seeing, correct?
Right. I mean, the numbers, are certainly have trended upward. I think there's multiple factors that go into it, and a lot of folks are probably not working. A lot of folks who are probably suffering with addiction, may not be able to get in to see their counselor and that sort of thing. And a lot of those things were being done by Zoom meetings, and everybody may not have the ability to have that technology, so they may be missing some of their counseling sessions. Some of their group sessions are probably no longer helping. But I think if you talk to the mental health workers in our area or any area, it's really tough times for them trying to keep up with their clients and trying to keep them involved and engaged.
Sure. So moving forward, what are you all at EMS doing to maintain that you guys are still making calls, still keeping people safe as much as possible?
Right. And, our response has not changed any. Obviously, with all of our patient contacts, we're wearing varying levels of PPE based on the information we receive for dispatch about the potential of COVID-19. The patient having it or somebody in the response house or place that we're going that could have it. Other than that, we've really not changed a lot. We do obviously take more precautions due to the COVID-19, and a lot of times it's difficult to do any screening on those folks prior or upon initial contact because they're unresponsive. We can't get any information about, potential positive tests, signs, symptoms, and that kind of thing.
For more stories just like this, always stay tuned right here to Wallingford Broadcasting Stations and WBON TV. For Channel 9 News, I'm Marissa Hempel.